So in this video, we're going to talk about interventions and kind of what that is and how to prepare for situations where they might be needed or necessary. An intervention is anything that is given to you or administered to you during pregnancy or labor that is not there automatically. For instance, if you are getting your membranes swiped to help encourage labor, that is an intervention. It is not something that would naturally occur in your own body. Anything from inductions, chemical pain management, fetal monitoring, any of those things are all interventions. Now, not all interventions are bad, and definitely not all interventions are bad for every single circumstance. For instance, fetal monitoring can sometimes pick up on distress in the infant that you cannot see from the outside, which is a very valuable tool and has saved lives for sure. So whenever you are analyzing your birth and creating your birth plan and deciding what is best for you and your family and your baby, you need to keep in mind your specific circumstances. For instance, if you have a high risk for something like preeclampsia, then interventions might be a better choice for you to help bring you peace and to help keep an eye on you and your baby to make sure you remain safe. With no complications, you really should look at the different possible interventions and decide which ones you think are absolutely necessary for you. And also that conversation needs to happen with your care provider so that you can work through with them. And if you feel like they are giving you accurate information and that they are listening to your concerns and willing to work within your birth plan as closely as possible, then leaning on their guidance is a very good idea. One thing I have on the list that might cause you to pause in the interventions list below is the eating during labor. Now, I put that in there because I believe that refusing women food during labor is an intervention. It is something that when you're in a hospital, they consider something to keep you safe, just like fetal monitoring or IV fluids or any of those things. But those things bring along with them risks. For instance, if a woman is not able to eat and the labor extends for a long time, she's going to get tired, and the more tired she is, the less she can do. And the harder it will be for her to manage the intensities of labor, and the harder it will be for her to have the fortitude to push her baby out when that time comes. So I want you to talk very closely with your provider on your options for eating during labor and drinking during labor and what things that they recommend are good for you to do, especially in the earlier parts of labor. And I don't have all of the interventions listed below, just a few that I happen to have some solid information on. Explore all of the intervention options, and we're going to talk more about the chemical pain management options below, so keep an eye out for that.